Good evening, everyone. You all are welcome to the breast cancer awareness session with Dr. Ismit Gabula ma'am today. So she has taken earlier a lot of sessions on the platform, but today she is also taking again a session on breast cancer to aware all the ladies here, and this is going to be a very informative session. She's also the founder of BSE for Life. We are on the platform of Get Set Up, which helps us to learn useful skills from people like you so we can do wonderful things together. Ideally, ma'am would be very happy to see you all on the cameras. So if you are comfortable like being on the camera, please do it. In that ways, we'll learn from each other. You can download the app for Android devices. We are still working on the iOS devices. The best way to participate is to join us and do register for a class on the Get Set Up platform. A quick disclaimer, Get Set Up is not paid to promote any specific products. Anything mentioned in the session is just for our help in the class itself and nothing beyond that. Our agenda today will be covering the following objectives. We will be understanding what is breast cancer, and we'll be getting a better understanding from a doctor, the risk factors and symptoms to be aware of breast cancer. And at the end, we'll be taking a Q&A session. And if time permits, we will be also taking a quiz. So it would be a great, informative, yes, a socialization session. Over to you, Ismat ma'am. I would like you to give an introduction of yourself.
Good evening, and thank you, Angela. Thank you to Get Set Up for inviting me. Can you hear me, right?
Yes, ma'am.
To inviting me to speak at this on this platform. Today we are talking about breast cancer awareness, and which is a topic which is very close to my heart. Why are we talking about breast cancer? Okay, so the idea is that to spread awareness about breast cancer. What is so important about breast cancer? Let's start with the beginning. Why is October? October is the month for breast cancer awareness, right? It is all over the world now. October is synonymous with breast cancer awareness, and the pink ribbon is also synonymous with breast cancer awareness. Right now, a little bit of the history, if you like. It was started in 1985 by the American Cancer Society when they wanted to promote awareness about breast cancer and promote mammography as a method of screening. The connection with, so that's when they started October as the month in which to promote breast cancer awareness. 1993, Estee Lauder company, Evelyn Lauder, started the Breast Cancer Research Foundation. And when they established that, they took the pink ribbon as the symbol. And that is now known worldwide as the symbol for breast cancer awareness. Of course, the Susan Komen Foundation was the first one to start in 1982 because of the death of Susan Komen, very young, at a young age of 36. So her sister decided that I have to do something about this, and she wanted to increase the research funding for breast cancer. All this, of course, happens in America, where they have taken a lot of steps forward. And so besides just creating awareness during this month of October, there is also all these programs. The programs are not, sometimes you wonder why so much pink. It's to increase people, to help people to donate so that they can increase the funding for research, because breast cancer is the most common cancer in women. Yes, is that right, Purnima? Very nice. So it is. Can I just share my screen for a minute here? It's not sharing, darling. Okay. Can you see the screen then?
Yes, ma'am. It's loading.
Yeah. So we come to why is breast cancer important in the world?
Ma'am, we can't see the screen. It's still loading.
Okay. Okay, let it load. I'll talk in the meantime.
Okay.
Why is breast cancer important in the world, right? It is important because it is the most common cancer in women. 1 in 4 cases. Let me know when you can see the screen. Can you see the screen yet?
No, ma'am. If you're facing any issue, should I present it?
Yeah, please do.
Okay, you can stop sharing the screen.
Okay.
And start present. Just give me a minute.
Sure.
Is it visible now?
Yeah. I can see the screen. Yes. Thank you. So when we look at this chart, we look at the first pie graph. We see pink represents breast cancer. Gray is a larger chunk, but it's a mix of a lot of other cancers. Individual cancers are pink, yellow, blue, etc. As you see, breast cancer is all 1/4 of the cancers that are being caused in women. So this is a big chunk, right? What is important is it's not only the one cancer, it is also the one cancer which is causing the most deaths in women. If you look at the graph that's next to it, in that, as we see, the red represents the deaths due to cancer. First is the breast cancer, of course, is the most common. And then we have the deaths due to breast cancer, which are, again, a lot more than any other deaths. Why is this important? Because breast cancer by itself does not cause death. Death occurs due to the spread of the cancer to different important organs of the body, which happens in the later stages. With research, what has been done, we have achieved treating early stage breast cancer. There is almost 100% survival for 5 years if it is caught early with the treatment available. And 8 out of 10 cases are found by women themselves, but at a later stage. Why is this? Because they don't know. Awareness is not there. Okay, so that is why it's important to spread awareness. So this is we're talking about the world. Now let's come to India. Can you change the slide, please? Thank you. Next slide. Yes, thank you. So in 2020, if you see, we saw the 2020 of the world, right? Which was a quarter, 24 to 25%. As you can see in breast cancer in India, 2020 shows us a 38%. The pink is a much bigger chunk of the pie. So we have more cases of breast cancer in India now. It is increasing. Besides this, go to the next slide, please.
Yes,
In young women, it has been found the cancer is much more. Classically, it has been known that breast cancer occurs in older age group. So usually younger women, when they get any kind of problem with the breast, they say, "Nahi, ye kuch nahi hai. It's not a problem. Let it be and let us just ignore it and go ahead with life." But that's not the case. We have to get it checked out. We have to be aware. We have to know that this can happen. In India, every 4 minutes, one woman is diagnosed with breast cancer. And every 8 minutes, there is one death due to breast cancer. So this is quite a bit, right? Therefore, it is important to catch it early. We cannot prevent it because we still don't know what is the cause. Let us come to who can get breast cancer. Like we said, can we go to the next slide, please? Angela? Yeah, thank you. So we know that women, of course, can get breast cancer, right? But men are also prone to breast cancer. Why is that? Because they also have breast tissue. It's a very small chunk. But 1% of men can get breast cancer, and they should know that if something like this, if there's a change in their breast, they should get it investigated and treated. Again, I went through the age group with you guys. The younger age group is now increasing, where earlier it was a much lesser demographic. Now we have older age, younger age group, much starting from the age of 20, you can get breast cancer. And that awareness has to be present. Besides this, pregnant women can get breast cancer, and lactating women, breastfeeding women, they can also get breast cancer. Now, this is important because it is the most common cancer happening in these women. If they get cancer, this is the one they'll get. And the cancer that they get at this time is usually quite aggressive and goes fast. So again, awareness is important. Now, when we talk about the lactating women, the breastfeeding women, a common problem that they face is mastitis, lactational mastitis. There could be a blockage of a milk duct, and then because of that, there is milk collection, then bacteria come in, there is infection and things like that, So what is important here is to know that it should be treated. Of course, you got to do the regular treatment, like, warm compresses, massage, etc. Do not stop feeding the child, because that it helps to remove the, sucking helps to unblock the ducts, right? And if antibiotics have to be given, that also will not harm the child. Usually they're given carefully, right? According to the necessity for the child, for the patient. But after 2 to 3 weeks, if there is no relief, that patient needs to get investigated for any kind of problem. A red flag should be raised. So then we come to what can cause breast cancer. Can we come to the next slide, please? Thank you. Cause. Next slide. Is it infectious? Can it be caused by a bacterium? Can it cause a virus? Is it something like typhoid or tuberculosis or dengue or even COVID? No. What we know of breast cancer so far is it is not an infectious disease. Viruses, yes, there is a relationship of certain cancers to viruses, right? We know of the HPV virus causing cervical cancer. But breast cancer, no relationship has yet been found. So then what is the cause? What we do know, we don't know the exact cause, but we do know that breast cancer is basically from abnormal cancer cells. These are cells which have mutated, which have changed. They have abnormal genetic material. And this makes them grow and proliferate, and they do not follow normal progression. So let's look at what normal cells look like. Can we have the next slide? These are normal cells all over our body. They grow, they do their function, and when they grow old of the disease, the body will take care by destroying them and putting new cells in place. They are uniform, well-defined, etc. What happens with cancer cells? Next slide, please. In this, we can see these cells are abnormal. They have an abnormal outline. They have abnormal nucleus. They tend to grow uncontrolled. They are rogue cells, right? Now, initially they are small, they're just a few in a clump, and they will not cause any problem. They will just be a painless lump. That is a really early sign. Now, when they grow more, they will compress. They will cause pressure on the neighboring tissues, and that might cause discomfort. When they grow further, they will press and move into blood vessels and lymphatics. When they go there, they can be transported to different parts of the body, important organs. Breast cancer tends to spread to the lungs, to the brain, to the bone, the liver. Now, these are very important parts of your body, and they are important for functioning. So if that spread happens, then there is more aggressive treatment required, right? So it is important. And then, of course, the morbidity increases, mortality increases. So these are important factors to keep in mind. Now, what we do know that we don't know the cause yet, right? But what we do know is that there are, can we have a next slide, please? Certain predisposing factors have been identified. With all the research that's going on, there are certain predisposing factors that are identified. What does that mean? Having these factors in place doesn't mean you're going to get breast cancer. Doesn't mean that you're not going to get breast cancer. It's just that increases the risk of developing breast cancer. Now, here again, we have two sets, one that cannot be controlled and one set that can be controlled. What cannot be controlled? When we talk about those that cannot be controlled, can we have the next slide, please? Basically, being a woman, they're a higher risk than men, right? So that is the first point. Then the family history, maternal family history. If your mother, your grandmother on your mother's side, your mother's mother, your mother's sisters, your cousins on the maternal side have had breast cancer, the risk for you to get breast cancer increases. By how much percent, you'll ask? If one person has had breast cancer, the increase is about 5%. But if more than 1% person has had breast cancer, the risk increases to 13.3%. So that is the kind of relationship with family history. When a person also, if you individually have hypertension or diabetes, the risk for developing breast cancer is more. But there's something you cannot do anything about except maintain a healthy diet, etc., which we will come to. Right? Now, we could talk about genetics. Genetics, what happens is the BRCA1 and 2 genes. Everybody's heard of them, right? We know a lot about them. We've heard of Angelina Jolie and how she did this and that, etc. That's where we've heard of. What we know now is that the BRCA1 or 2 genes are basically good genes. They are present in every human being. They are tumor suppression genes. They will fight with the cancer cells and prevent them from growing. Our body naturally likes to protect itself. So it does various things in order to protect itself. One of them is by having these genes. These are good genes. Now, if they are changed in some form or the other, if they're mutated for whatever reason, then they cannot suppress those cancer cells. Now, if they cannot suppress the cancer cells, they will tend to grow. How do you get these mutated genes? Two ways. One is by inheriting it, and two is in your lifetime, they can mutate due to various reasons, not all of which have been identified. How can you inherit them? From both your parents, your mother and your father. Either one can give you the BRCA1 or 2 gene. Now, what happens when you get this gene? The chance of getting cancer increases by 50 to 80%. It's not 100%. You not necessarily are going to get the cancer, but the risk factor increases. So, and besides, the BRCA1 gene is more related to breast cancer and ovarian cancer, while the BRCA2 gene is more related to prostate, pancreatic, and many other cancers. Now, so this is why then genetic counseling, etc., comes into place. Suppose there's a family history, then that's why they advise you to do genetic counseling. Then we come to the predisposing factors that you can control. When you come to that, can you go to the next slide, please? There will be external environmental factors and internal environmental factors. When we talk about external environment factors, basically we're talking about radiation and hormones. These are the ones that have been found relationships with breast cancer. Radiation, when we talk about radiation, what do you mean? It's not about the nuclear bombs or something. No, it's day-to-day radiation, medical radiation. If you go to get an X-ray, you are getting radiation. So indiscriminate use of medical resources, indiscriminate X-rays should not be taken. You should avoid doing that, because guess what? You're increasing the risk of mutating and getting abnormal cells. You're increasing the risk of developing cancer. How does this happen? We have this habit. Oh, I've got a cough, I've got a cold. Maybe I get X-ray chest. Let me go get one. Or my hand is hurting. Maybe there's a problem. Let me go get one. Things like that. Unless there is a need for that and it is advised by your doctor, do not get X-rays. And if it's going to make a difference to the diagnosis, it is not necessary to expose yourself to unnecessary radiation. Mammograms are also a pretty big culprit. Mammography is the gold standard to screen and to pick up early breast cancer. Yes, definitely. But it also increases the risk of radiation. So earlier they used to say at the age of 40, you start doing mammos every year, right? But now they don't advise that. And they say that you should do it after the age of 45. And depending on your history, your family history, your health, medical history, it's done either every year or the alternate year. So reducing the risk. Besides, mammography has improved. There are newer methods, newer ways of doing it, where the radiation dose given to the patient is much less. Coming to the next point, hormones. What does that mean? We have female hormones in our body. Primary is estrogen. Estrogen tends to fuel cancer growth, breast cancer growth. Now, as we now, the basic thing it would be when you are if having an extended exposure to estrogen increases the risk of breast cancer. Naturally, what happens if you have an early menarche, if you start your menses early, if you go to and you have late menopause, your duration of estrogen in your body is definitely longer. Also, if you have a late pregnancy and you don't breastfeed, there is more estrogen going around in your body, right? So that's why there is advice. Of course, you can't do anything on menarche and menopause, but what you can do is about having the babies early, breastfeeding. So it's not only about the baby getting an advantage, the mother also has an advantage in the sense that it is helping her to fight against breast cancer. Besides this, hormones are given nowadays quite often. People are reaching out for these. In cases such as you talk about, what do you call it? 1 second here. So infertility and PCOD. These are two conditions which are very common in women these days. Because of the stress, there's a lot of PCOD. And then there is, of course, the infertility stuff. Now, what happens with these conditions? Usually hormones are given to control, maintain, etc. Short duration giving and under a doctor's supervision is acceptable. It's good. But longer durations is not good. Now, what happens? Women, because of these kind of conditions, usually people go from doctor to doctor sometimes, from one doctor to the next, not necessarily telling the second one what the first doctor had advised. So unknowingly, the doctor might give another hormone, and which will continue, and therefore that duration of hormone in your body is longer, and which is not advisable. So these are things which we should be aware of, and therefore we can take it, control it. Can we have the next slide, please? Then there are predisposing factors which you can control. So this is the internal environment of the body. Like I said, the cancer cells are in your body. The body is normally fighting them, right? And with the BRCA genes, and there are others. So different methods in which the body will fight against them. So we can help our body and create a good natural internal environment by these basic factors, such as doing regular exercise, reduce alcohol consumption, reduce red meat consumption, avoid and reduce processed foods, and avoid being overweight. Now, this overweight is interesting because guess what? As you grow older, menopause hits and your estrogen levels fall, you tend to put on weight, right? Estrogen is falling in your body, so that's good. But the body wants to help you. The body wants to protect you, so it makes estrogen. How does it make the estrogen? It converts androgens from the fat cells in your body into estrogen. So if you have more fat cells, there will be more estrogen production. And then again, that whole thing about increased estrogen predisposing to breast cancer. So let's help ourselves and keep our weight down. Yes. Now, so this is like an overview of what are the factors that we cannot control. When we come to detecting, now let's say how do we detect breast cancer? Yes, thank you. The World Health Organization decided to step in because of the magnanimity of this problem, and they have advised certain things. First is education, creating awareness, which is what we are doing right now. Then they advise screening programs, and they advise that they should begin at the age of 20. Because as you start you will get, the risk is there that you can get breast cancer. Then advising for that, for a minute, I can just talk for a minute here about the age of 20. What happens is when I have a personal experience. I was in hospital and getting my chemo while patient next to me, a young girl, my daughter's age, and she was there with the breast cancer. And so, you know, these things happen, and it's important to be aware. The thing is, she went to her doctor, and the doctor 1 year ago, and the doctor said, "No, this is nothing, please go away." So she went away, and then when the next year she had it increased in size, there was pain, she went back. Luckily, that doctor was on leave. So the next doctor said, "Nothing doing, let's get this checked out," and it was breast cancer. So it's important to be aware and take your health in your own hands at times. Besides screening program beginning at the age of 20, what they say, one is monthly breast self-examination is to be advised. Regular annual clinical breast examination. Should go to a doctor for a health checkup, for a breast health checkup on an annual basis. And like I said, the mammogram after the age of 45, depending on how advised. Next slide, please. So we come to what should we do? What are the steps that we should take? Can we take to the, what are the steps that we should take? First is to know that this problem can occur to you. It can happen to you. Then you have to know what to look for, right? You have to know what are you looking out for. Is it just a lump? Then to do that, you do regular breast self-examination. It's a protocol that has been described well, and it has been laid out, so that should be done. If you find some problem, you should know what steps to take and then to take those steps. Each of these points is important. You should know what to look for it, and find something, please take the next steps. Yes, next. So what are the things that we have to look for? There are various signs of breast cancer. It's not only about the lump. The first sign would be to look for a increase in size of the breast. Now, these are changes, right? These are not, you might have asymmetric breast to start with, and that's fine. But if they are symmetric, but you notice while doing your breast self-examination on a regular monthly basis that the breast is increasing in size, then that raises a red flag. Not all cancers will start with a lump. It might just be an increase in size. The next one is the lump. The lump can be present in any of the whole area of the breast. Where does that extend? From under the collarbone to under the breast, from the armpit all the way to the breastbone. In this whole area, there is breast tissue. It can be there, and if there is any kind of lump, nodule, etc. you find, which cannot be explained, which cannot be taken care of, then you have to raise the red flag and investigate it. The armpit lumps are usually lymph nodes, but sometimes there is breast tissue in some areas as well. Then we come to the presence of nipple changes. The nipple is normally everted, in the sense it is pointing outwards. Now, some people have a normally inverted nipple. So what happens if that nipple gets inverted on examination? You notice that your nipple is turning inwards. That has to raise a red flag, and you need to get it investigated. If there is scaliness, rashes, itching, now these things can happen if there's a, if you change the bra and you have use some different powder and this and that. So yes, rule out everything. And then if there is still no solution found, then you look at it being suspicious and getting it investigated. Dimpling of this, changing in the skin surface. If there is dimpling, puckering, orange peel appearance, discoloration, thickening of the skin, all these things, if they cannot be explained by any reasoning that you can have, if you've changed things and your material which you wear, etc., then it needs to be investigated. Pain. Now, pain is a very interesting point. If it is continuous and in one spot, that is when you have to get worried about it and have a check. So how do you find out these? Can we go to the next slide, please? By doing regular breast self-examination. Yes, Angela, next slide, please. Thank you. Okay, we just go, these are just graphics, so I don't really like to show, but the breast lump, swelling in the breast, lump in the armpit. Next slide. Discharge from the nipple, inversion of the nipple, rash of the nipple or irritation. Next slide. And dimpling, etc. of the skin, which I discussed. Male breast changes also have to be noted. Come, next slide, please. That brings us to breast self-examination. When does one do it? It should be done around the 4th or 5th day of the monthly period, every month. If you no longer have periods or your period is irregular, pick a day of the month, 1st, 15th, whatever works for you, and do the examination. Why is this? Because the breast tissue changes with the hormonal changes, the cyclical hormonal changes in the body. So it's better to check it at the same time. Usually some breasts are tender. So we advise after the 4th or 5th day of the cycle, because by the time the swelling has reduced and stuff like that, so you're less tender and you can actually do the checkup more comfortably. It takes about 10 minutes and where it's to be done in the privacy of your own home. It is well described and it is well known. There are various videos vagera available which you can look and understand this. But not every woman does it. Not all women, even though they are educated, they know about it. They have family history. It's not always taken care of. It's not done. You do it once in a while, maybe, yeah, whatever. I myself am a case in point. I was very particular. And I had nodular breasts. So I used to get regular checkups and I had family history. So my aunt had breast cancer. And so I was concerned and I did used to get a regular checkup, mammograph and do my BSc. At the age of 57, I was busy with other things in life and I missed doing my breast self-examination, my mammogram for a few months. And one fine day, I found a nice hard lump the size of a marble with lymph nodes. It was stage 2B cancer. When that happened, it struck me that if something like this happens to me, what about the other people out there? And that's when I decided I have to do something about it. Once it was confirmed that this was indeed breast cancer, I sat with my phone and I called up all my friends, relatives, whoever I could think of, please get yourself checked. Do a regular check. And I committed to doing this, creating awareness of breast cancer. After I finished with my treatment, it took a while because you know what, the chemo does leave its fog and brain fog, and there are side effects which happen. So it took a while, but I got around to it, and here I am today. Okay, so coming to the breast self-examination, I had to tell you all guys about this. Coming to the next slide, please. Thank you. So there are 2 steps to this. The first step is to look. You stand in front of a mirror and look at yourself in 3 positions, with your hands by your side, with hands on your hips leaning forward and hands raised up and leaning forward. In all 3 positions, you look at front and from each side view. By this, what happens is if there is any change in the size, what all the changes we discussed right now, any of those you will pick up, visible ones, right? And the movement is to pick up armpit lumps, arms above the head will help you pick up lumps which are under the nipple area because they will be stretched out and then they will be visible. Once this is done, we come to the next thing, which is examine yourself. Can we go to the next slide, please? This is done in a lying down position. If you are examining the right breast, you lie down comfortably with slightly moving over to the, leaning to the left with a little cushion below your right shoulder. The idea is to flatten the breast. Raise the right arm and put it above the head, and using 3 fingers, the pads of 3 fingers of the left hand, circular motions are made at three pressures: light, medium, and strong. And with that, you tend to understand if there is any kind of lump at any depth, you will be able to pick it up. The circular motion can start from under the collarbone, going all the way under the breast, starting from the axilla, armpit area, all the way to the center. Around the nipple, you go in circular fashion. Try not to pick up your hand while you're doing this, because that is the only way that you don't miss out any area. Different people have different ways of doing this, whatever works for you. But if it works for you, this way, the up and down motion is the most convenient for me. To explain this, and of course, then you repeat the procedure on the other side. Let's go through a short video where this doctor has explained it. Can you play that video, please? Yeah.
Hi, I'm Dr. Laura Cooper, one of the
Is
breast
this sound
surgeons at City of
audible, ma'am?
Hope. Today I'm
Yes.
going to talk to you about self-breast examination. Around 8 out of 10 women detect breast cancers or breast lumps. Hi, I'm Dr. Laura Cooper, one of the breast surgeons at City of Hope. Today I'm going to talk to you about self-breast examination. Around 8 out of 10 women detect breast cancers or breast lumps themselves. Therefore, it's important that every woman understand the basics of a self-breast examination. There are actually 2 components: look and feel. For the first part of the exam, looking, you want to stand or sit in front of a mirror. With your clothes off, you want to look at both breasts to see if there are any differences between the 2. Examine the nipples to see if there's any difference between the 2. Is one redder than the other? Is one pulling in? Then you want to put your hands on your hips and turn from side to side to see if there are any changes. While standing, you actually want to put your arms forward on your hips, because this will bring out lumps that might not appear otherwise. It's important to raise both arms above the head. This will draw out any puckering or dimpling for masses that might be underneath the nipple. If you're standing like this and you have a mass that's kind of in the lower part, you might not see it at all. But when you raise your arms, what happens is that mass kind of stays, and then the skin kind of pulls in as you're pulling up. That was the first part of the examination. For the second part, you want to be lying down. You want to put your head on a pillow to prop yourself up and place one arm behind your head. Then with your other hand, you want to use your first 3 fingers. When you use only 1 finger or 2 fingers, you can actually separate the breast tissue and think that you feel something that isn't there. You can do this one of 2 ways. You can either go in a circular motion all the way around the breast, making sure that you overlap every area, or you can go up, down, all the way across. I prefer the circular motion, from the collarbone to the sternum or mid-chest, below the breast, and then all the way actually out into the underarm. Lymph nodes are underneath the underarm, and sometimes those can become bigger. When you're doing the breast examination, you're looking for things that feel different from the surrounding tissue. What you're looking for is something that stands out, something that feels like a pea or a marble or a walnut. You want to make sure that you do this examination the same time each month. Remember, the most important thing about a breast self-examination is to know your breast. That way you can note any changes and alert your doctor.
Thank you. Thank you. Thank you, Angela. So that brings us to the next point, which is, how, suppose you think you find something. What do you do, right? First step is to go and see your family doctor, the one you're most comfortable. And when you go to your doctor, see that you bring the topic as what you have gone for is primary. You don't hesitate and are embarrassed in any way, you don't go and say like, I've got a cough, I have a cold. Okay, please, I also have a lump. Can you check it out? No, you go and say, I have a lump. Please help me know whether this is anything to be worried about. And the doctor finds, and you feel that you're comfortable with the doctor's opinion, perfect. But if you feel you're not comfortable, don't hesitate to reach out to another doctor for another opinion. Finally, this is your body, right? Now, if the doctor finds there is something to be that is suspicious, they will advise a mammo. First, they will advise a sonomammogram. A sonomammogram is a more easier examination to be done, and it's commonly done in India first. If the suspicion still persists, a mammogram is advised. If the mammogram shows some doubtful changes, then a biopsy is done. Only after a biopsy is done is there any confirmation of breast cancer. It cannot be confirmed to be breast cancer unless there is a biopsy report. That is after which the treatment can be initiated. So each of these tests has its own importance. Can we have the next slide, please? Thank you. Sonography. We'll just go through them briefly. Sonography by itself is not painful. There is no radiation involved. And the advantage is that it can distinguish between cysts and solid masses. So it can tell you if, and fibroadenomas, which are common solid masses and they are benign, can be picked up very easily on ultrasound. Can we see a next slide, please? We can see a few pictures, right? So then when we see this, we can see that there's a cyst, which is a black hole kind of things. And if it's a simple cyst, it'll have a smooth outline. Then if there's a fibroadenoma, it'll be a solid mass, which will have a smooth outline. Cancers, on the other hand, because they grow in such a rapid and random fashion, they don't have a well-defined outline. They also have microcalcifications. These are not very well picked up on ultrasound. They are better picked up on mammos. And of course, glandular tissue exists, which is ecogenic, right? Then we come to the next picture, please. Next one, Angela. Yes. So these were the simple ones. These are the normal appearances. We just discussed a simple cyst of fibroadenoma, a normal lymph node. How it looks, it usually has an ecogenic center. Next slide, please. And then the abnormal ones. There was none more? Okay, fine. So then we come to mammography. What is mammography? Mammography it's the gold standard. 90% of cancers will be picked up on mammogram because the early ones can really be picked up. The microcalcification, like I said, are very visible. But it involves radiation, so should not be done in pregnant women. And it cannot distinguish between cysts and solid masses. Also, when we look at, can we go to the next picture, please? The breasts of women are different at different ages. At a young age, what you see is glandular tissue, more glandular tissue. This is more white looking, right? And cancer also looks white. So it will, on a mammo, will be very difficult to distinguish. As you grow older, the fatty component increases in the breast, and therefore the visibility of cancer is better. Come, next slide, please. Yeah, these are very tiny microcalcifications, just for your information, right? And then the biopsy, which is done under ultrasound guidance, and a needle is put, a piece of tissue is removed, which is checked out. It will tell us exactly what is the kind of cancer, type of cancer, whether there is hormonal dependence, whether there is, all those factors will come in, HER2 positive, etc. Next slide, please. So then we come to the treatment. What is the basis of treatment? Basically, it depends on the type of the cancer, the stage of the cancer, the sensitivity of the cancer to various hormones, and the medical history of the patient, right? But there are 4 basic pillars of treatment. One is the surgery, Then there is the chemotherapy, radiotherapy, and maintenance. Right? So depending on each case, the doctors will decide how it has to be treated. There's usually a team of doctors that works here. There's an oncologist who will take care of the entire course of the treatment of the patient. There is an oncosurgeon who will take care of the operation. The radiation therapist who will radiologist, who is a radiation specialist, who will decide where and how and exactly where the radiation has to be given. And then, of course, that's about it. And then the maternal support staff. Surgery is done in, it can be a partial surgery. Can we go to the next slide? Yeah, so it can be a partial or just a lumpectomy. It can be a mastectomy, depending on how big the tumor is, how far it is spread, if there are lymph nodes involved, etc. Usually a lymph node is removed, or all are removed depending on patient to patient. Chemotherapy can be given before the surgery or after the surgery, and depending on, again, from case to case. There is now newer therapies are available called the targeted therapy, and there is the hormonal therapy, depending on how the report of the biopsy comes through. Radiation therapy is given once you finish with the chemo. With the surgery, you remove whatever cancer is there. With the chemo, you kill whatever cancer cells are present. Chemo is usually quite strong because it kills cells and not necessarily distinguishes between normal and abnormal. So then what happens is you end up losing things like, fast growing things like hair, the nails get damaged, etc. Besides this, now there are these targeted therapies. So that with the newer development, they will only focus on the cancer cells. So they will only kill the cancer cells. So the side effects are less. Then radiation is given depending on patient to patient. If they feel that there's a need to kill any balanced cancer cells that may be left in the body, that is what is done. Maintenance therapy is now given quite regularly depending on the patient and the kind of cancer for 5 years, 10 years. This is to prevent any dormant cells that might be present from growing and bringing the cancer back. Okay, so then that brings us to pretty much the end of how we tackle cancer. But commonly people have a lot of common problems in the breast, right? These are day-to-day problems. So does all of these, will they indicate breast cancer? So let's just go through them for a bit. Pain is the most common one. I discussed that if there is a localized pain in one spot which is continuous, that is when you worry about it as being cancerous. Often people get this pain and they get confused sometimes. So it can be a cyclical pain or a non-cyclical pain. I'm talking about non-cyclical, the persistent one, which is indicating cancer. Cyclical pain is usually hormonal, comes and goes. What happens is, because of the confusion, you don't understand or want to focus. So what do? A simple hack is you mark on your calendar for a month or two, which are the days that you're getting the pain. And you might notice there is a pattern. Usually the pain occurs a few days before the period, and then it passes off. This is cyclical pain. So then okay, this is not to be worried about. Let's go to the next thing. And then we have to ignore it. The other thing is the lumps, correct? People having lumps. One is lumpy breasts. So these are fibroadenomatous breasts. Can we have the next slide and the next slide? Angela, 1, 2.
Yes, ma'am. Just a second.
So what happens is that fibroadenomatous breasts are lumpy breasts, and you feel that you have lumps in your breast, but not necessarily that is a problem. That is normal, right? What is abnormal is a single lump, which is a dominant lump, which is separate and different, and you can identify it other than the regular breast tissue. Next, please. Next slide. Next slide. Next slide. Okay. Yeah. Thank no. Go back. Go back. This one. So let's stay with this one. The lump, the dominant lump can be, it can be an abscess, it can be a cyst, it can be a fibroadenoma, or it can be cancer. These are the various different ways in which it can, you can have a lump in the breast, and of course lymph nodes.
Ma'am, we are left with only 5 minutes.
Okay, we're almost done. Thank you. So, so we just go through this quick, just the lump. So when you have 80% of the time, the lump is normal, right? It is not, it is benign. It is not abnormal. 20% of times it is cancer. So we want to be sure that what we are finding is not cancer, right? So it's important to get it evaluated. So now that we can't go into the details, I'll just go through it very briefly. A single lump, we did that. And so there are the abscess you can make out, of course, because of if there is plain inflammation, then you get a lymph node and then you get treated. A fibroadenoma usually happens in the younger women, you know, the teenagers, and as the breasts are developing and the hormones are cycling, these are developed in the lobules of the breast, and there will be changes. They will usually be tiny, small, and they slip under the finger. The doctor can identify it very easily, and usually it's one, maybe more, and they don't really grow much, and that's you don't really worry about it. When do you worry about a fibroadenoma? When it occurs in an older woman. When that's happening, then you want to investigate it, that it is truly a fibroadenoma and nothing else. Fibroadenomas by themselves will not turn into cancer. That is a done. Then we come to cysts. Cysts by themselves are simple cysts occur, and usually sometimes they will occur in older women. And what happens, sometimes they might come up suddenly and cause pain. They have squishy feeling if they're on the surface, and if they're on the underside, it might feel hard. So again, an ultrasound will help you to identify it. If it's a simple cyst, the wall will be smooth, and usually these are investigated by putting in a needle, aspirating the fluid and checking it out. If they are complex cysts, then of course they need to be evaluated further. So that is what brings us to the nipple, and we discussed the nipple and the nipple discharge and skin changes earlier, so I won't go into that, right? Okay, so that brings me to the end of this simple the talk about breast cancer awareness, and I hope I have been able to impart some information which is valuable and help you to take care of yourselves better.
Ma'am,
Any questions? Yes, we can.
Only 2 questions.
Yes.
Okay. So Gunjan ma'am is asking, can taking hormonal contraception increase risk of breast cancer?
Yes, depending on, see, short term, this is what I explained, short term and, you know, focused understanding, yes. But if you have family history, if you have all of those other things which are, you know, which are predisposing factors, then you have to be a little more careful about taking contraception for any length of time. Yes. Because again, those are also hormones only.
Yeah, that's it for the questions.
That's it?
Yeah, there are a lot of compliments for you in the chat box.
Okay.
So that you have explained very well, and it was actually a very perfect explanation. We understood every point that you told us, and thank you for being on the platform.
Angela, I asked a question. Can doctor answer that?
Yes, tell me.
Yeah, I'm having a Premarin for the last 40 years since my hysterectomy. So should I stop it now?
What are you taking it for?
Because I had hysterectomy when I was very young. The doctor advised me to take this Premarin.
Okay. No,
yeah.
I'm sorry, I am not aware of the the name of the drug. What is it? Is it a hormonal thing? It must be the estrogen.
Primarin, yeah, primarin.
Which
It's
is
a
estrogen.
hormonal.
Yeah.
The hormone.
So now, see, Usha, the thing is, you have to be in relation. You have to talk to your doctor about this. She has to advise you. And if there is any, it is helping you, which is why you are taking it, right? But if you are taking for a very long time, and then you have to go into the next level, so might need to stop it.
Yeah,
But
it has been
please
40
consult your
years
doctor.
actually. For
Yeah.
40 years I'm taking.
Right. So then you need to consult your doctor and take next steps. Yes, it's important to take next steps.
Okay.
Yes.
Yeah, thank you.
Ms.
Thank you
Smith,
so
ma'am.
much.
Thank you.
Actually, I have to leave for another session as well. So
Okay.
if anyone has like, if they don't have any queries, we can end the session here. Thank you for being on the platform. Yes, Gunjan.
Hi, just a quick question. So you mentioned, like it was very informative session about, how do we detect that? So I am working in a community with a rural women, and so if I want to address this issue of, what do you think? How, like, what could be the strategies to, inform the community about breast cancer awareness? What do you think, Justin?
Yes, it is very important. We have to talk to them about these things, and we have to do it in their language, and with slides and with explanation. I think it is important. We can break it out to much simpler. See, this was a little more advanced conversation because this is the forum is such. But I've done simpler talks for and in Hindi, for people who need to know. Everybody needs to know that this can happen. Yes, in the rural areas, we find that there is a lesser incidence as compared to the urban areas, because guess what? Their environment is also better, right? And their diet is also better, right? So they have, if you go to the Himalayas and if you go to the Northeast, they have less incidence of breast cancer. But in Mumbai, it's high. Bangalore, it's high. So, these are the things, yes, but they should know, because they come only very late, and it is the woman herself who finds it. 8 out of 10 cases are picked up by the woman, but it's at a later stage, and she finds it when it becomes painful, it becomes unbearable. That's when she will go, because they're so embarrassed. So they should know that they have not to be embarrassed. They have to take their health and give it as much importance as necessary. So Gunjan, I would be very happy to work with you on this topic.
Sure, that would be my pleasure. Thank you so much.
Thank you, everyone. I'm getting a bit late for the next session. So I'll end the session here. Thank you, Smith ma'am, once again for being on the platform and for such an informative session.
Thank you.
Thank you.
Much, and thank you everybody for being
Thank
here.
you.
I
Bye,
hope
everyone.
you can all take this forward and share it with whoever you think would benefit. Please do. That is the whole purpose of this. Thank you.
Yes, ma'am, for sure. Thank you. Bye, everyone.
Bye-bye. Thank you.
Bye.